Hello and welcome to this evening's webinar. My name is Brianna Gregory, a pharmacist and physician liaison with Physicians Preference Pharmacy, and I want to thank you for joining me today as we touch on a topic that I find to be very fundamental, especially for functional and integrative style practices. So I thought it was probably overdue to give a talk on this topic, and I'm going to be discussing the role of Candida overgrowth in your patients and what you can do about it. So I'm going to go ahead and share my screen here as we get started. So this is something that when I visit practices, I oftentimes find that this is not currently being incorporated into the practice model. And so as a practitioner, I want to let you know that this is one of the easiest things to implement. And it's very easy to get started with right away. And you're also expected to have your patients start feeling a lot better, as well as resolving some symptoms that may have gone unresolved for a very long time. So please be sure to take some good notes on this one. Of course, you're going to get copies of the PowerPoint, but I do, as always, like to kind of bulk up my PowerPoint so you have lots of things to refer back to. But I'm going to give you some clinical pearls as I see them to be fit. So we're going to go ahead and discuss treating Candida overgrowth in your practice, and let's go ahead and get started. So as always, I like to start with a bit of a background of who we are at Physicians Preference Pharmacy. If you're already prescribing with us, you're probably already aware of some of the basics, but we do have a different belief than a lot of other pharmacies do. So we certainly believe that prescription drugs are commonly overprescribed. So this is why we take a root cause approach as we support your practice, as we support and partner with our patients to help them get well. We don't want to just treat their symptoms, but of course we want to take into account how they're feeling, what their labs are, what they're showing up with, and approach them as a whole individual. So we specialize in bioidentical hormone replacement therapy. That's really our bread and butter, and that's how we got started. We also specialize in peptide therapy, which I will be discussing a little bit of this evening, as it does have a role in this topic, and immune modulating compounds, which has really come to be actually a large part of what we do at Physicians Preference. Now, each of our preparations are going to be free of any unnecessary dyes, binders, fillers, artificial sweeteners, lactose, parabens, which of course are hormone disruptors. And this actually, I always mention this when I talk about our compounds, but I would say that some of the compounds that we're going to discuss this evening particularly apply as being important in not having some of these bothersome ingredients. So listen close for those. We do currently ship to 49 states. And when I say ship, I mean ship directly into. So we don't ship directly into the state of Alabama. We hope that that will be changing soon, but that is to be determined. And we still do have patients in Alabama, though. We just have to ship to another state, and then those prescriptions can get forwarded to them. And we still honor our 24 to 48-hour turnaround time, which is very important to us. All of our patients are equally important regardless of what they're getting filled. And so we have seen many shifts in other pharmacies as far as what we're hearing from patient and prescriber feedback of that turnaround time getting to be very long and wait times to be very long, but we strive to provide much better service to you than that, of course. We also still hold our PCAB accreditation. So the Pharmacy Compounding Accreditation Board, which is a voluntary accreditation that we go after, it requires multiple and routine surveys and on-site inspections. And essentially what that boils down to is that as a 503A compounding pharmacy, we do have rules and regulations that we have to abide by the State Board of Pharmacy, and in fact by 49 state boards of pharmacy, because we're licensed in 49 states. However, we do have stricter standards in those because we believe that that's important, especially when it comes to the testing of our compounds. And we do that primarily in two ways. We start out by weight testing our products on site, and that does give us some verification of the quality and the strength and potency of our product. But we also have all of our technicians that compound send out several samples several times per month to our third-party laboratory that tests those for potency to be sure that essentially what we tell you And what we tell your patients that we're filling is what we're actually filling, what they're actually receiving in the mail and in their vial. So we came here to talk about Candida overgrowth, and if you don't already know, we are located in Houston. So we definitely have a problem. We have got patients that are showing up with all of this myriad of symptoms that, truthfully, with some of the compounds I'm going to be discussing, we can actually get a really good handle on these symptoms collectively. So I know you're seeing these in your practice. We're talking about, unfortunately, anxiety, depression, belching or bloating, gas, abdominal discomfort. Sugar cravings is a really good indicator that there is some Candida overgrowth going on. And I'm about to give a basis of what Candida overgrowth is, but I just want to paint the picture of what this person looks like when they show up in your office. Indigestion, food allergies, chemical sensitivities, skin rashes, eczema also I would put in here, brain fog, oral thrush particularly, as well as weight gain. So I think that for us to have this conversation around Candida overgrowth, we have to first set the stage as we reframe our approach to gut health. So Candida is something that lives mouth to anus. And so I'm going to talk primarily about the gut right now, but let's just take a step back and remember that health starts in the mouth. So anytime that we put food in our mouth, of course, the digestion process is beginning. In fact, even as we begin to think about food, we salivate and that digestive process is beginning. Now, a lot of those problems ensue in the gut and show up as GI symptoms. So, as I mentioned, we take a root cause approach and we want to really support your practice in doing the same. So when we take a root cause approach, there's many things that we can look at. I think fundamentally we need to start with foods, what's going in our patient's mouth. Maybe they need to be bringing you a food diary and you're keeping an eye on that. Also, oral hygiene products. So interestingly, I am the daughter of a dentist. I basically grew up in the dental office, and my dad practiced general dentistry for many years. So I grew up with that conventional approach, did everything conventionally as far as oral hygiene. I'm a huge fan, I should say, I have been a huge fan of Listerine my whole life. And the more that I really began to understand the microbiome of the gut and how that extends into the oral microbiome and how that impacts our overall health systemically, I have fallen away from many of those conventional beliefs. I oftentimes will tell patients, please cut the mouthwash. I don't use mouthwash anymore. I think part of what's important here, and it even actually plays into patients' ability to utilize the environment of the mouth to appropriately dissolve and absorb certain dosage forms. When we take away or wipe out the natural flora that's existing in the mouth, we are taking away part of the efficacy of that digestive process. So using the right type of toothpaste, having the conversation with them about fluoride-free toothpaste if that's necessary, how that can have an impact on the thyroid, doing away with mouthwash, addressing their root causes of stress. We know that that really disrupts the gut big time. Of course, it causes inflammation, and we know that inflammation is the driver of all disease. So if we can cut inflammation off at the root cause, we'll be much better off. Helping them identify and address stressors. Of course, that's going to have effect on the adrenal glands too, but it also weakens the endothelium of the GI tract. And that primarily, where I see that being an issue, is it leads to food allergies. Also, the dental hygiene routine, of course. Are they going in for their routine checkups? I like to have this conversation with dentists because dental treatment and the general practitioner treatment is very segregated in our current system. And so I love to see the interaction between those professions. But actually, there are very few people set up better than dentists to help screen for candidiasis. Of course, they usually see it in the form of oral thrush. But again, mouth to anus, we have growth of Candida albicans already. So when we take a step back, we want to look at the root cause. The center section here, I have kind of bracketed because I will be focusing primarily or starting with the depletion phase in the gut. So again, the gut is like a garden. So we really want to kind of rake it clean, weed it out, deplete what's in there, kind of get the weeds out, and then replete it by planting new seeds and giving the body back what it needs. So we're going to focus heavily throughout this webinar on yeast-free elimination and what that dietary approach looks like. Also the use of antifungal prescriptions, and additionally repletion. So there are many ways and so many things that we can do to affect the gut. It's a very resilient system, but we'll focus on probiotics, also how to repair the tissue, and we'll do some of that with peptides as well. So first, I just kind of want to cover what candidiasis is. So candidiasis is a fancy way of saying yeast overgrowth, but with Candida albicans. So candidiasis is a fungal infection caused by Candida overgrowth, primarily caused by Candida albicans. So Candida albicans is something that we naturally have living mouth to anus. It's there, it's supposed to be there. It's just like with any other balance in the body. When our body becomes weak, when we become stressed, when we experience inflammation, we weaken the system, and then it allows some of these bacterial or fungal species to take over, cause an opportunistic infection, cause sickness, cause allergies, and all those things that we don't want. So really, if we can keep the body in balance, we will be much better off. Also, it lives in the vaginal tract too. And so typically when we think of a yeast infection, most of our minds go to a female yeast infection in the vaginal tract, and that's very likely, but that's not all that we're talking about. So this really can cause major problems, which is what I usually see on the conventional side, is the patient shows up with a long list of symptoms like I showed on that second slide: anxiety, depression, bloating, gas, and they're given an antidepressant medication, or they're given maybe just gas eggs or something like that, which really are just kind of masking the issue. For one, not addressing the root cause. And then of course, we all know that you should come with a long list of side effects that we simply do not want. So we want to address this opportunistic infection that's occurring. All right. Again, we're taking a root cause approach here. So some of the disturbances of the mouth and the gut environments that we want to address would be stress, inflammation, the diet. We want to be sure to pull patients off of that modern or standard American diet, which is usually high in refined carbohydrates and simple carbs and sugars and refined and processed foods. All I hear when I hear that is just inflammation. So we want to help them cut that out. As much as I dive into this topic with people, especially pharmacist to patient, it still boggles my mind, but I have to remind myself that that's not common knowledge, what the modern American diet is and how poor that is. Now, with recent administration changes, I think that's becoming much more highlighted, at least allowing people to be more informed and make their own decisions, which I think is great. We always need to be empowering our patients that way. At the end of the day, what they eat when they go home is their business and their job, but it is our duty to inform them. We also want to killing off the intended and protective oral microbiome, like I talked about with the certain types of toothpaste or mouthwashes, which may be kind of creating a clean slate in the mouth. We love the feeling of the clean teeth, but we don't want to wipe away everything. We still need to have those digestive enzymes that are present and not getting rid of everything. And of course, poor oral hygiene is going to be a big problem. We could have a whole separate conversation about root canals and about cavitations and how that leads to cardiovascular health and the dental meridians and how that leads back to certain teeth are connected to nerves that then innervate various organs. And we can really draw a parallel or the line directly back to some of the organs that are being affected by inflammation. Again, a whole separate topic on its own, but very interesting. And then probably the more common would be the recurrent use of antibiotics, which wipe out the gut. We know that if someone has used antibiotics within the last 90 days, that they are considered to be immunocompromised. And so we really should be treating those people differently and being very proactive. And if we can't be proactive, then at least be reactive or just active in helping to repopulate their gut after it's been wiped clean from antibiotic therapy. So some symptoms that should be addressed with this Candida overgrowth is leaky gut. So that goes hand in hand with candidiasis. Food allergies are ones that I see a lot of. Immune disturbances, weight gain is pretty big. And I think that this is largely driven by a toxicity issue. And it's very interesting that, I mean, yes, we have a really big weight gain problem, specifically in the United States, but in other places as well, is the body is very smart. And so one of its first survival tactics to keep us alive when it perceives toxins is to add on water weight. And it's doing that to dilute the toxins that are in the body, to keep the cells safe from some of those toxins and kind of create more of a bath or a soup than just a direct interaction with some of those toxins. So that can lead to weight gain. Headaches, of course, brain fog. We hear a lot about that recently. And then some of the skin issues like the rashes, as well as fatigue. So people just feel, they feel fat. I mean, people come in and say, I just feel fat, or I just feel 6 months pregnant, or I just ache. These are a lot of the things that I hear people say. So our solution to that is a yeast-free approach to healing. And we're going to talk about what is all involved in this. So the yeast-free, we have different names for it that we refer to in the pharmacy. And this was kind of adopted from the physicians that we partnered with early on that kind of brought this concept to us. Is we may refer to this as the yeast-free eating program or the yeast-free cleanse. We usually recommend that our patients do this about once a year, but especially, and hear me when I say this, when people come to you for the first time as a new patient, this is something you should be running them through. So point being is we are exposed to so many toxins and inflammation and stress, and foods that we can't eat perfectly or can't eat perfectly clean will cause inflammation in the GI tract, leading to the necessity of doing this cleanse at least once a year if you can convince your patients to do that and guide them to do that. So please save this list. Again, you'll get a copy of this PowerPoint, but please keep this handy because you can absolutely share this with your patients to make it as easy on them as possible. Grocery shopping is very hard for people. They don't really understand mostly how to do it, where to start, how to prepare meals, especially on an elimination diet. So usually, and I will go further into this, our yeast-free regimen is usually somewhere around 1 to 3 months, depending on how severe the patient is as far as their symptoms go. During this time, the following foods on the left-hand side of this slide are okay. The foods on the right-hand side are to be eliminated. The reason that we eliminate various foods is either because they themselves are highly inflammatory, they impair digestion, or they feed the Candida. One of the things I will tell patients is to encourage them to hop on board with this elimination diet is that craving sugar is not their fault. I tell them that the Candida is craving the sugar and driving those sugar cravings and recurrently reaching for food. And I think it's important. Of course, none of us intend to shame our patients or anything like that, but there can be a big stigma around weight gain in particular. And especially when someone's not feeling well, we want to be sensitive to that. So I think that helps to drive them and allow them to understand why we ask them to cut out some of these foods. So of course, the processed foods, a lot of this will have an overlap with gluten. So if you've got patients that are already gluten-free, they're going to have an easier time with this, especially as they experience yeast die-off. There will be less yeast die-off. So we like to keep it pretty simple. Again, this is usually between 1 and 3 months of treatment. Month 1 is where the most restriction comes. So after month 1, after they have eliminated out these foods and they're going forward with the treatment, in moderation, they can begin to reintroduce fruit and brown rice and sweet potato, oatmeal, yogurt, and then also alcohol again. I usually recommend doing more of the distilled, like the vodka or lower in sugar, or even tequila are usually the better choices with water or with maybe a soda water or something like that, a tonic or something, just something like that, that is not going to be, juice mixed with it and is lower in sugar. So you can certainly pass that list along to your patients. That's very helpful for them. Also, I've heard that some people will send out a designated person from their office. They don't have to do this with every single patient, but go to the grocery store with them. I actually recently recently met someone a couple weeks ago who told me something very interesting about some bonus incentives in their office, which I thought was great. And he said, someone took it upon themselves to take this patient out to the grocery store and they got a small bonus from it. I thought that was wonderful. Let's encourage and empower our patients with the knowledge so that after they leave the office and they go to grocery shop and take these things into their own hands, they're actually successful. So let's talk about depleting the gut. Part of the elimination diet of keeping yeast out is part of the depletion. So especially the first time that you encounter a patient and you get them started on this yeast-free eating program, this is very important. Please tell them, wait at least 1 week after you've decided to start eating yeast-free. Wait 1 week after you begin doing that. So you should have done it already for 1 week before you start into the medications. So nystatin is not a new prescription. I'm sure you've heard of it, but ours is different. I'm going to tell you why. But nystatin addresses Candida overgrowth in the colon. So just in the gut, doesn't get systemically. And that patient is going to experience yeast die-off. So if they experience yeast die-off and they're taking something like nystatin and they're not eating yeast-free, or they're taking something like nystatin and they just started eating yeast-free, they're going to have more yeast in the gut naturally from food consumption, and they're going to have a harder time. They're more likely to self-discontinue. Also, if you have a patient coming in for the first time and you're starting them on other products like hormones, I like them to start on those hormones first, or those essential medications first, like thyroid or sex hormones or peptides or whatever that might be. And then start this about 2 weeks after that first visit. In my clinical experience, what I see is that if people start it all at one time, they have the perception that side effects, which usually the side effects are yeast die-off, are side effects of the hormones. And then they'll self-discontinue the hormones. So I like them to start hormones right away, start eating yeast-free, give it a couple weeks. Once they've eaten yeast-free for at least a whole week, then they can start into nystatin. And I'm about to show you the stepwise fashion of how we integrate these compounds. So nystatin we compound at a 500,000 unit capsule. Now, ours is compounded sugar, dye, and paraben-free. Commercially available statin has my sugar in it. So please, if you're trying to kill off the sugar in the gut and the yeast, please do not give your patients nystatin with sugar in it. It's counterintuitive. Directions we recommend are to take 1 capsule 3 times daily with meals for 2 weeks, and then take 2 capsules with meals 3 times a day for the rest of the bottle. So you would fill this or write this for 180 capsules, and then they can keep repeating this. So that first bottle lasts them a little bit over a month because they're titrating up, and then they can keep repeating that for up to 3 months at a time. Again, most of our patients do this January, February, March, because there's that general push and motivation in the beginning of the year. I'm going to get things together. I'm going to be healthy. And so it's a good time to kind of drive them forward. After they finish the first bottle of nystatin, whether or not they're going into month 2 or 3 of nystatin, they need to take the round of fluconazole. So this is, making sure that they don't have any other drug interactions or any conditions that would stop them from taking fluconazole. But they would do 1 month of nystatin, and they would do 1 week of fluconazole. So this way we are covering the GI tract with the nystatin, and then we're covering the systemic yeast overgrowth that has leaked out from the gut into the blood. So we cover everything, and they just do 1 tablet one tablet daily for 7 days. And this is not overlapped with the nystatin. So we go nystatin, fluconazole, nystatin. And the fluconazole is not compounded. It's just your traditional 200 milligram, 100 milligram diflucan. All right. So continuing with depleting with the gut, if you were kind of liking a stepwise fashion a little bit better, I did create this if you're kind of more of a table person. So that first week that they start into the treatment plan, they're going to start that yeast-free diet, and then they're going to eliminate simple carbs and all the lists that I put on the on slide 7 with all the foods. During that whole first month, no yeast, sugar, milk products, alcohol, fruit. That's when they start the compounded nystatin capsules after being yeast-free as far as eating yeast-free for 1 month. And then I recommend starting a probiotic along with this. It is greater than 4 billion CFU daily. I also recommend rotating probiotics every 3 months. And so that is to keep the gut microbiome on its toes, to keep it diverse, and to help meet different needs, especially if someone has just come off of antibiotic treatment. Doing the yeast-free cleanse is also really good to do as far as timing wise of the year, based on when you're seeing that patient, if they've just done an antibiotic. So a lot of times I'll have patients come out of surgery, they'll be on an antibiotic prophylactically, and then their prescriber will come in with a yeast-free cleanse for a few months to heal the gut because they've just been wiped clean with the antibiotic. But also, when I say that about probiotics, you want to know what strains are being depleted with the antibiotic they're on, so you can help get them with the best probiotic. So additionally, as patients have the yeast die-off symptoms, usually what happens is that nystatin that acts locally in the gut, it is going to kill off that yeast. When that yeast dies off, it is going to create an acid. And so that acid buildup is what causes discomfort or the yeast die-off symptoms. So yeast die-off symptoms generally show up in the form of headaches, joint aches, abdominal cramping is usually what happens. And so as far as those, it can be very helpful for patients to use something that neutralizes the acid that comes as a result of yeast die-off. And so using something like Alka-Seltzer Gold can be helpful, or even some baking soda and water can be helpful. And just out of personal experience of doing this myself, I recommend actually doing that with every nystatin dose, at least until they get past those initial symptoms of yeast die-offs. That can be very helpful. During months 2 and 3, still important to avoid yeast and sugar. Adding some products back in sparingly. Again, you can go ahead and see slide 7 with the list of foods, and then continue with the compounded nystatin if their symptoms are showing to be bad enough to continue, which would be the original symptoms that they showed up with. And then again, take 7 days of fluconazole following that first round of nystatin. All right. I recognize this is small and not even super clear because it's photocopied actually, but I'll share with you what's here. So a couple patients that have been tested in the blood looking at the immunoglobulin, so IgA specifically, of Candida albicans in the blood. And so initially this patient, this is before starting the yeast-free program and before starting our compounded nystatin, comes in with a 0.92, the value of 0.92. And then after 60 days of being on this treatment plan, comes back into range at 0.68 for Candida albicans. Patient 2 shows up initially with a value of 1.26, and after 60 days comes down into range at 0.44. All right, so one of the places that we oftentimes will see yeast attempt to exit the body when someone is going through a cleanse like this is the toenails. And so this is a actual before and after of someone who used our antifungal nail solution, which is a proprietary formulation that includes itraconazole, terbinafine, tea tree, and also urea. It's got some DMSO in there as well to help it penetrate the nail best. Just like with any nail treatment you've probably prescribed, we expect them to use it at least about 4 months, simply because it's very hard to penetrate the nail. So we ask the patient to, as you can see, it comes in a nail polish bottle, is to paint the top of the nail. And usually it's toenails. I'm not sure I've really actually ever had a patient use it on their fingernails, but usually the toenails. So they'll paint it on the top, just like if you're getting a manicure, and then also get underneath the front of the nail, because of course that's the easiest place to penetrate and to get really underneath the nail, which is what we're trying to achieve. This here, again, is an actual before and after. I recognize the lighting's a little bit different here, but what I'm trying to show you is that there doesn't appear to be as jagged. For one, you can see that all of this very disrupted growth has all grown out. So I don't think it took the 6 months to resolve the fungal overgrowth, but obviously it takes time to grow that nail back. And so that nail looks a heck of a lot healthier. All right, so just some notes on the yeast-free regimen in general. The duration of treatment depends on the persistence and the severity of the yeast overgrowth symptoms, of course. Usually it's about 3 months, but a minimum of 1. I recommend repeating that at least once a year. And then using the sugar-free. Nystatin is important for overcoming candidiasis. It just makes absolutely no sense to me that we are putting sugar in nystatin, which is supposed to kill yeast. It's like putting a hormone in an endocrine disrupting base. It just makes zero sense, but it's still happening out there. I can't explain to you why. Topical treatments should be expected to be used about for 4 months for complete resolution. All right, we've talked about root cause. We've talked about depleting. Now let's talk about repleting. So love probiotics. Big fan of probiotics, especially to repopulate the gut and following this yeast-free cleanse. One of my favorites is Saccharomyces boulardii. But if they are using the prescription nystatin and fluconazole, they'll need to wait until after they finish those prescriptions to use the Saccharomyces boulardii, because Saccharomyces boulardii is sensitive to nystatin and fluconazole and will likely kill it off, if not all of it, some of it. So start eating yeast-free, nystatin, fluconazole, repeat nystatin if necessary, and then Saccharomyces boulardii. I made the comment earlier about recognizing which antibiotics your patients have been on so that you can intentionally direct them on which probiotics to be on to replenish what they have become deficient in. This is something that I was not aware of until probably about 3 years ago. And I really don't talk to very many people who are aware of this information either. So I'd like to take this moment to highlight this about probiotics. Oftentimes, patients that have inflammation in the gut also have some sort of histamine issue in the gut. I oftentimes see that people have an issue either genetically breaking down histamine, and or more people are showing up in our offices and pharmacies with some level of mast cell overactivation, whether that's full-blown MCAS, mast cell activation syndrome, or not. And that goes hand in hand with histamine intolerance, because histamine is good until it's not. So a lot of probiotics that are considered to be good and very popular probiotics actually have histamine producing strains of bacteria in them, which can exacerbate the issue. So you put your patients on probiotics thinking you're doing a good thing, and they may be getting a high histamine strain. So strains which support mast cells by reducing inflammation, here's just a list. I would say that my favorites, and actually the ones I usually see people become deficient in most frequently, at least from the antibiotics I usually see people on, are your bifidobacters. We also know that patients with COVID and with cancer tend to be deficient in bifidobacter. Lactobacillus rhamnosus. Love this guy. This is really, really good, especially for bringing down histamine levels or protecting against the effects of histamine in the gut. And then I already mentioned Saccharomyces boulardii. So these are all safe for overactivated mast cells. And then high histamine probiotics that you would want to stay away from. Not that they're bad for everybody, because not everybody has an issue breaking down histamine, but I also don't necessarily want to introduce something that could increase histamine. So here's some that are listed here as well. This one, the lactobacillus, I don't know if you say it KC or KCI, but this lactobacillus strand in particular is the one that is really hard to find a probiotic, many probiotics that do not have that in it, especially when I try and look at probiotics for kiddos. All right, one of my favorite topics. Let's talk about peptides briefly. So I've done several talks on peptides alone. This is a huge topic, a very helpful topic. If you're not currently using peptides in your practice, it is time that you start. So if you've never heard of a peptide, then other than a collagen peptide, for example, let me just give you a very brief explanation here. So peptides are short chains of amino acids that naturally occur in the body, and they work as signaling molecules. So that's a lot like what hormones do, and they function a lot like hormones, except for they're much more specific and they have a lot lesser incidence of side effects. So they naturally occur in the body. But just like with many things, hormones included too, with age, with inflammation, with injury, with trauma, our levels of peptides can decline. So we have to come in and replace them. Again, peptides are very selective. We love that because it decreases our side effect profile. And so when we come in and we replace peptides with compounded peptides, those are man-made peptides, right? So same thing as like with oxytocin or something like that. The options that we have that are specific for gut healing are two that I want to address. One is PDA, pentadecapeptide arginate, and two is called larazotide. So just to make this easy for you, because there are a lot of similarities between the two, I've created a table to show and highlight the differences. Now, if you've been using BPC 157 in your practice, then PDA is going to be your answer to it now that the FDA has taken away BPC 157. I say now, it's been about a year and a half. I want to acknowledge that I understand a lot of people are still compounding it. We got strict direction from the FDA over a year and a half ago that that was a no-go anymore. And so that's why we no longer compound it. But PDA, pentadecapeptide arginate, is actually the same sequence as BPC 157 with an arginine attached at the end. So there are a couple of things there. There is the thought that the arginine being present and attached to the BPC 157 molecule will allow it to hang out a little bit longer. Peptides are very quick on, quick off with their mechanism of action, which is good because they go where they need to go, they get the job done, and they get disintegrated in the blood. So many of these are on and off so fast that you can't even measure them in the blood at circulating levels. So some of the benefits of PDA would be that it reduces inflammation in the upper and lower GI tracts. It also specifically works on reducing inflammation in muscles, tissues, and tendons. It improves collagen production and inhibits prostaglandin pathways. So when you think inflammation, think PDA. If you know nothing about peptides, let me tell you one thing, because I have spent years diving into the topic of peptides, and based on my clinical experience, we can stack peptides. That's kind of what we call it, is basically using one and then another and another. Sometimes they'll work synergistically. Your first line or first choice for a peptide should always be the one that's the most anti-inflammatory and probably gives you the broadest anti-inflammatory benefits. In this case, in the case of what we have on our formulary, we're talking about PDA. So come in with PDA first. It's very gentle, but very effective. Larazotide decreases gut permeability, especially in celiac disease. In fact, that's one of the indications for it. The reason why is because when we ingest gluten, it releases gliadin, which is what actually causes the problem. And then that increases zonulin levels. Zonulin can be measured in the blood. And zonulin is an indicator of oftentimes the beginning stages of autoimmune diseases, of diabetes, and we want to be sure that we do not have high levels of that. So especially for those that are prone genetically to developing an autoimmune disease if they consume gluten, i.e. celiac disease, this is a really nice choice, especially if they have to go out for a meal, for example, and there's the chances of cross-contamination. So what if your patient doesn't have celiac disease? We know that larazotide is actually really good for helping clear spike proteins out as well. So the dosing will change as far as the frequency of dosing as well, based on what we're using it for. But one of the issues, as you know, with Candida overgrowth in the gut is it weakens the cells that are supposed to come together and fit very tightly in the GI tract. And so once we have the weakening, we get leaky and we start exchanging nutrients and toxins from the GI tract in the blood. The body's very smart. It goes, boom, tags it as a food allergy. And so now you have a food allergy and people wonder why. when they go for a food allergy test, everything that they eat shows up positive on the food allergy test because their gut is leaking. So let's heal that. But again, let's kind of control the inflammation first and then address the tight junctions. One of the main differences here is that lorazepam works different because it actually physically rearranges the filaments in the tissue in the gut. So it doesn't just seal up the lining, it actually rearranges it in a more favorable way that helps to keep the nutrients in and the toxins out. The PDA is a sublingual tablet. Don't let that discourage you from using it for gut issues. They will dissolve it under the tongue. They will get absorption into the gut, and it will go everywhere. The PDA goes everywhere. Lorazepam, that comes in 2 strengths of a capsule. What about how to dose it? So for PDA, if you've got a patient that has something like candidiasis or an issue like this, we can give them 1 tablet daily. It comes in a 1 milligram tablet. 1 tablet daily. If the patient also or has an acute injury, like the 80-year-old woman that we recently had come in that fell out of a tree. I don't know what she was doing in the tree, but she called us to tell us this specifically. She was up in a tree for some reason, fell out, was prescribed Vicodin, and was semi-controlled. Added on the PDA for the pain and inflammation, was able to drop down her dose of Vicodin, which is awesome. I was even surprised by that considering how strong the Vicodin is. But in a case like that, you can easily have your patients take 1 tablet twice a day for about a week. If it's a little longer, that's fine. And then back down to just 1 of the tablets daily for maintenance. The lorazepam is more or less weight-based. It's not exact, but for those under 25 kgs, you'd start with the lower dose. Over 25 kgs, you start with the higher dose, and it's usually favorable to give your patients BID coverage. For both of these, your patient should expect to commit to about 3 months of treatment or until their symptoms resolve. And then with side effects, I don't think we've had any reported with the PDA. Again, this is just a replacement of what your body naturally makes, which is BPC 157, which I hadn't mentioned yet, but your body naturally makes BPC 157 in the gastric juices 24/7. And it's just that plus an arginine molecule attached to it. The lorazepam studies have shown that in healthy subjects, some of them reported headaches, but not those that were originally symptomatic. They did well. So here's an example of a prescription order form that I'll be sure that you get because you attended this webinar here. And I like to provide these for all of our compounds that we offer at Physician's Preference, just because if you're not faxing, or even if you are faxing or e-scribing, if you're not e-scribing, then you can use these. If you are e-scribing, then you can at least use information on these sheets to give you some dosing guidance. I really like patients to do the 3 months of nystatin orally if they can tolerate it, and if they're going to be consistent with it and compliant with it. Now, you will see a 1 month, 2 month, or 3 month regimen on here. If you've got a patient that you really think it's going to be a compliance issue and you just need to let them hit it hard for 1 month, then that's fine. You can see that the quantity will change. We also do offer a nystatin suspension. This is almost exclusively used for kiddos or for patients that have oral thrush. And then the fluconazole, again, not compounded. And then here is your information on the antifungal nail solution. Got my references here, and I want to thank you so much for attending our webinar. I also want to remind you that as prescribers, you always get a 20% concession on all of your prescriptions. With one exception, that would be mebendazole. We do not provide concessions on mebendazole, but if you are prescribing with us and you're getting your personal prescriptions filled with us and you're not getting this 20% concession, we've been doing this for a long time, but if you're not getting that yet, just please let us know. If you have not prescribed with us yet, then all you need to do on that original prescription is write on there somewhere or indicate on there somewhere, if you're not self-prescribing, that you indeed are a prescriber, and so we need to apply that 20% concession to you. Once we see it the first time, then we will go ahead and enter it in your profile, and we will take care of you going forward. So I'm going to stop sharing now. And if you've got any questions, certainly you can go ahead and drop them in the chat. See if we've got anything in here yet. I do want to also talk about the pricing very quickly. So when it comes to the pricing for the antifungal nail solution, we're usually looking at, or we are looking at $52. That's for 15 milliliters, which is the quantity that will need to be prescribed. For 1 month of the nystatin, if they just did the 126 capsules, $91. For 180 capsules, we're looking at $130. For 360 capsules, we're looking at $251. So that pricing has really been very consistent over time for us. Again, in my personal experience, what I recommend is getting patients started on this at the beginning of the year, and they will be most successful. I have a lot of resources that I'll be sure you guys get too. I also have handouts, I have newsletters, I have brochures, I have flyers, I have all the things to help support your practice. And we also have some physicians in other states, like halfway across the country, we have a physician's office that does a ton of this in their patients. And probably every couple months, they ask that I ship them a box of flyers. So we try to make the education very easy for you guys so that you can spend more time with your patient and less time doing what we can help you do. And so if you ever want me to drop ship a box of those to your practice, I'm also more than happy to do that as well. So we are going to have our next webinar. We're trying to do these about every other month now. So you'll go ahead and you'll get a recording as well. But if you have further questions or anything that comes up, you're always more than welcome to shoot me an email. I put my email in the chat box here, but it's my first and last name, brianna.gregory@physicianspreferencerx.com. If you've got questions about particular patients in general or case studies, those are probably my favorite. I'll help you tackle those and we will figure it out together. It doesn't look like I have any questions coming through in the chat box. So again, if anything comes up, let me know. But I want to thank you again for joining today, and we will see you next time.